Good evening, everybody, and welcome to Financial Freedom Classroom. We accelerate your results. Tonight I am flying solo because John is recovering from a run up Gunstock Mountain. And so I'm going to talk a little bit about us quickly. John is the owner of Lock in Your Success LLC, stock options trading, coaching, and education firm. Together we've managed many successful businesses in a variety of industries. We are active real estate investors, and we do provide loans and guidance to small businesses. The disclaimer, I'm going to try to do this justice. We are not tax preparers, CPAs, attorneys, or accountants, or so any advice we give is general in nature and would need to have specific guidance from a professional. Please seek their guidance. And so tonight, that brings us tonight, we're untangling healthcare options for individuals, couples, single parents, and families without employer-sponsored plans, which gets really, really confusing. So tonight we brought in an expert, and her name is Alice. She specializes in healthcare, Medicare, long-term care, disability insurance, life insurance, and ancillary products here in New Hampshire. We are very fortunate and grateful that she's coming on to talk to everybody tonight because it is a very confusing topic. Welcome, Alice. Can you say hello to everybody?
Thank you.
Hi, Alice.
Can you hear me okay, Sherry?
Yep, I can hear you. Can everybody hear Alice okay? Can you just... Well, we'll let Alice talk a little bit as we go in. You can just let me know if we're having audio problems. But so if we jump right into it, Alice, can you talk a little bit about signing up for a plan and what that entails?
Sure. The changes with the Affordable Care Act, that actually the plans that took place starting January 1st, 2014, the rules changed a bit. So it's more like a Medicare environment now where there's annual open enrollment periods. Before, you could pretty much pick up a plan. There may have been health questions, but you could pick up a plan at the beginning of any month during the year. Now with the Affordable Care Act, there is an annual open enrollment period, and that's the time you can sign up for a plan. So for example, right now for the year 2015, the annual open enrollment period is closed. So if someone right now, today, does not have a health plan either through their employer or one that they've purchased themselves, unless they have a special enrollment period, and I'll talk about that in a second, they won't be able to pick up a health plan until the next open enrollment, excuse me, for January 1st, 2016. So the annual open enrollment period for 2016 will start on November 1st. So on November 1st, people could start actually enrolling for plans that would start in 2016. So the open enrollment period is November 1st of this year to January 31st of 2016. However, if someone wants to sign up and have their plan start for January 1st, 2016, they need to enroll in a plan before December, I'm sorry, I have a typo there, before December 15th, 2015. The rule is that if you want your plan to start at the beginning of any month, you need to sign up by the 15th of the prior month in order for it to take effect on the 1st. If you sign up on the 16th or after, then it will start the next one. So for example, if you want January 1st, 2016, you need to sign up by December 15th, 2015. If you sign up on December 16th or thereafter, then your plan would start February 1st, not January 1st. I find myself constantly apologizing to people that it's so crazy, but that's how it works.
So
there are
yeah,
times,
okay.
I'm sorry?
No, I think I'm going to wait to ask the question I have, so until the end.
Okay.
Go ahead.
So there are times when a person is eligible for a special enrollment period. For example, if they're losing employer coverage, if you had coverage through your employer, you're able to be in a special enrollment period. But again, you need to sign up, even though, like, say you're going to lose your employer coverage at the end of July, like July 31st is the last day you're covered. You would need to sign up in order to be covered for August 1st. You would need to sign up before July 15th in order to be covered for August 1st if you're losing coverage. If you're in a special enrollment period, the same rules about applying by the 15th apply. Something that I also want to make sure people understand is if you choose COBRA and you're in a COBRA plan, like you're continuing your health insurance, you've left your employer, you've chosen to opt for COBRA, you cannot opt out of COBRA until the next open enrollment period. That's a big sticking point that people don't understand. So make sure that if you're going to be leaving your employer coverage for any reason, that you would make sure that that you knew what the rules were before you opt for COBRA. What does it look like if you did something for yourself, or what would it look like if you went with COBRA?
Right. And that's,
sorry, that was a lot to throw at everybody.
well, I mean, I think it's very fuzzy on how to go about this, and I think that this helps a lot to clarify, knowing that you have to be enrolled by the 15th for the following month to start, right? And if it's after that on the 16th, then you're not able to start the following month.
Right.
It would be the following month, if you will. So
I know.
So
yeah.
that does help.
So,
I mean, I think.
Yeah. So say if you sign up on January 31st, 2016, that will be the last day of the open enrollment for 2016. And if you don't sign up by then you're pretty well stuck for the rest of 2016 unless you qualify for a special enrollment period. But if you did sign up on January 31st, your coverage would start March 1st.
So let me ask, I guess I'll throw this question out here now. So what happens, let's say, if you don't have health insurance?
What do you mean what happens? If you don't have health insurance today?
Well, let's just say that you missed the open enrollment period and you don't have insurance.
Well, then you're not able to, well, a couple of things. The first thing is that you will not be eligible for you won't be eligible to enroll until the beginning of, until the next open enrollment period, until 2016. Now, there are other circumstances. For example, if someone was going to be eligible, became eligible for Medicaid, that might be a special enrollment period. But if you're the average person not eligible for Medicaid and you have not done anything and you're not covered today, as far as the marketplace goes, you would not be able to sign up. Now, if you started employment and you're able to sign up for a group health plan, that's completely different. But for this conversation, we're talking about individual and family insurance.
Right.
And
now,
the other thing is there are penalties for not signing up or for not being covered under the Affordable Care Act because it is the law. So there are penalties, and I always tell people, they're like, oh, well, what's the penalty going to be? I heard it's 2% or whatever. But I always refer people to their accountants because it's really important that you understand what that penalty looks like. And it's determined by, your taxable income, the number of dependents you have, joint filing status, if any, et cetera. And there's different levels for individuals and families. And it's based, like I said, on your a percentage of your income over your tax filing threshold. So I always refer people to their accountant for that.
Right. I just wanted people to understand that there is a penalty if you're not covered under health insurance. So
there is.
Yeah, unfortunately. Okay, so
because it's the law.
Yeah, because it's the law.
So
the next slide is let's see, how do I sign up for a plan?
There are several ways to sign up for plans. Well, not several, but there's a few. You can, and people have their own level of comfort with whatever. So I wanted to make sure that everybody knew what their options were because I'm an insurance agent and I can help people sign up for plans, but everybody doesn't want to go that route. So I wanted to make sure people knew what their options are. So your first option is you could go directly to the insurance company. So for example, if I wanted to go with XYZ company and buy their insurance plan, I could either go to their website or call them up and sign up directly. Now that would be off the marketplace exchange or healthcare.gov, but you can do it. You wouldn't be eligible for premium tax credit if you went that route, but you could certainly go that route. The other option is to sign up on the marketplace at healthcare.gov. So you go on there, and people that are fairly savvy can go on and pretty much sign themselves up. I mean, once you get through the different screens, and it's pretty user friendly. It's come a long way since the first days. And if you get stuck, you can call someone at the marketplace and get help. You can use an assister. An assister is someone that you can go to in person, and each state has a couple of assisters. And you can go, and by a couple, I mean a couple of companies that do it. You can go sit down with someone. They'll take you through the marketplace, help you sign up for a plan. An assister cannot recommend a plan, one plan over another. They can basically tell you, this plan covers this, that plan covers that, here's what you should look for, that type of thing, but they can't recommend a plan for you, but they can certainly help you find and sign up for a plan. And then there's an agent, like myself, a professional. And one thing I want to point out, and this is true with a lot of insurances, actually most insurances, is that if someone uses an agent, or if they don't use an agent, in health insurance, they're going to pay the exact same amount of money. There's no, you're not going to save any money if you don't use a professional. So, of course, I'm an agent, so I'm going to say I have to be held to different compliance than an assister or someone who's working for the marketplace. So I have to be licensed in my state. I have to be certified to be able to do this, help people with these plans. And I'm not selling myself. I'm just saying an agent in New Hampshire, or in whatever state you're in. So, get the professional advice. If you have an agent, you can call them during the year. It doesn't cost you any more money, so that's the way to go. But again, it's a comfort level. Some people just don't, they're afraid they're going to be sold to or whatever. So that's why I like to tell them what their different options are.
Right. So now an assister, can you explain I just wanted to go back to that for a second. Can you explain just a little bit more about how does an assister get paid, or who do they work for, or how does that work?
They get paid by, right now it's grant money, so
Okay.
they're paid by the federal government, by federal government grant money, I should say, not by the federal government, but by grant money. And I'm looking through my notes here to find out if I can tell you the local. I can never remember the name of the one in New Hampshire. Here we go. It's Cover New Hampshire is the name of the assister group in New Hampshire. If you just Google Covering New Hampshire, in our state, for example, you'll be able to come up and find assisters. They also have a spot on their site where you can go find an agent if you want to also. But they receive grant money from the federal government, and then they train and educate the assisters so that they can go out and educate and train the clients. Yeah.
So so an assister hasn't necessarily worked in the insurance, like healthcare insurance field for a long time, or
no, they know this specific. Yeah, they know their specific piece of the market, which is, the plans that are on healthcare.gov or whatever.
Okay. Well, I can highly recommend using an agent because Alice has been awesome. So,
thanks, Sherry.
Let's. So, is there anything else?
We can recommend plans because I do frequently. An agent can absolutely recommend a plan, whereas an assister can't, which is frustrating for them a lot of times, I'm sure.
Yeah. Well, Alice has been a big help, and she definitely can cut through some of the. It's been a really good feeling to talk with her to kind of like hash things out. So, and it doesn't cost any more. So that's a good thing. So the next, is there anything else we want to talk about signing up for a plan before we move on to the next question?
Not unless anybody has any questions.
Okay. Does anybody?
I'm good.
Okay. I haven't gotten any. So let's talk about what should I consider when choosing a plan? It's a big one.
A lot, yeah, it is. Because people don't. I mean, it's so different than it used to be. You used to get your insurance, you go to the doctor, you pay your $10. I'm totally dating myself, and you'd be good. And now it's like there's so many things you need to look out for. So I really want people to really know what they need to think about. So I mean, and it's not a gigantic list of things, but some very basic important things. So, do you want to be able to use your doctors outside of your state or outside of your region? So, for example, in New Hampshire, there are, for 2015, there are, that are still selling health insurance. One of them has just stepped out, but there are 4 health insurance companies in the state, and one of them has plans that you can use. Well, no, 2 of them have plans that you can use outside of New Hampshire, but only one of those 2 has a network that's truly outside of New Hampshire. The other one just has a couple of hospitals in Massachusetts, but they're not anything to speak of, so it's not that big a deal. Some people are fine. They're like, you know what, I don't travel a lot. And when you travel, emergencies are typically covered as if they're in network. So if you're, say you're on a business trip to, Florida, and you have an accident and have to go to the emergency room, that's going to be covered under your insurance. But some people want to be able to, they might have a child in college who's in Georgia, and they want that child to be able to use their health insurance while they're in Georgia. Or they may want to be able to go to the Boston hospitals or go to Maine Medical Center or whatever. So a lot of the plans these days, because they're trying to keep costs down, a lot of the ones in New Hampshire that are available are hospitals and doctors in New Hampshire only. So you want to make sure that you understand the network. Excuse me, I'm getting over a cold chair. I didn't tell you that, so I'm sorry I'm sputtering here.
Oh, that's fine.
And then even when you do that, you want to make sure all your doctors and specialists are in the plan's network. I tell people, if you're married to your doctor, let's make sure that your doctor is in the network of the plan that you're choosing, because if they're not, then you're going to be unhappily surprised. And I don't like surprises unless they're really good ones, like a surprise birthday party or something.
That's right.
And I really don't like my clients to be surprised. So whether you're using the sister or you're doing it on your own, these are things you really need to know. Make sure that your doctors and your specialists are in the plan's network. You want to know how your prescriptions are covered, and are your prescriptions covered? So, for example, if you have a medication that is a must-have and it's a fairly expensive one, you want to make sure you know how it's covered on the plan that you're purchasing. Because, again, if you don't and you get that plan and the open enrollment period ends and you're stuck in a plan that doesn't cover a specific medication that you really need it to cover, you're going to be stuck. So you want to make sure you understand that.
Right.
You want to understand the services that have a copay and what services you'll pay for until you meet the deductible. So the technical term is subject to the deductible, which means, what that means is something going to be paid after the deductible? That's all that means, is that it's subject to the deductible being paid first. So a lot of plans, especially the bronze plans, because the plans are different metal levels, sort of like the Olympics, bronze, silver, gold, and platinum are the plan levels. And, of course, a bronze plan is less expensive but doesn't cover as well as a gold plan. I think there's only 1 or 2 platinum plans in New Hampshire. But so you want to make sure that, because some plans have, there's no copays or anything. Everything is after the deductible. You have to meet the deductible first. So if you want to be able to have a $20 office visit for your primary care and a $50 specialist or a $100 specialist copay, then you want to make sure that's in your plan. Some plans have, if you go to a certain lab, you can, it'll be a better copay, you'll have a better copay than another plan. So you want to make sure that the services, you want to understand how they're paid. Is it a copay? Is it a percentage? What is it? So that's what you want to know. And then how are the services critical to you covered? For example, mental health benefits. If mental health benefits are important to you, then you want to make sure that, is it a copay or is it after the deductible? And what mental health facilities can you use and how far can you go? Mental health is a big one to consider because oftentimes I've worked with clients that have wanted to get treatment outside of the state, but if they have an HMO plan, chances are that's not going to work for them unless they have a very specific one. So, you know, for those kinds of plans, you just want to make sure you know how they work. Or if you have a chronic illness, you know, diabetes or, you know, something like that, you want to make sure that you understand how that's covered and how the components of that chronic illness are covered.
Right. That's, if we could just jump back to the question before that, I just have a quick note or question. I guess I have a question about that. So you're covered under, let's just pick, I don't know, Harvard. Let's just pick Harvard. And just say that there's something that says it's subject to the deductible. Let's just pick like an emergency room visit, say. If it says subject to the deductible, is there some kind of negotiated rate that insurance company has for that, or it's whatever,
Yeah,
it would be whatever somebody just walking in would just pay?
Yeah, no, that's an excellent question. There are negotiated rates. So even though you may be paying something until you meet the deductible, the amount of money you're paying is not the same as if you were just walking in off the street without insurance. There's a negotiated rate. So, for example, Harvard Pilgrim would negotiate with, you know, whatever hospital they're working with. You know, here's what we're going to pay for this service. Here's what we're going to pay for that service, and then they negotiate with the hospital. And each plan has, you know, each company has their own negotiated rates, but you know, they tend to be pretty consistent, or at least seem to be.
Mm-hmm.
Now, the emergency room is one that's a really good question, Sharon. I'm glad you brought that up because the emergency room on some plans is after the deductible. So be careful when it says there's a copay. Look a little further, take the next step, and just look at the summary of benefits and find out, is it a flat, straight-up copay, or is it a copay after you meet the deductible? Then it's like $250, blah, blah, blah. So you want to make sure that the emergency room is a big one that people should understand.
Right. I mean, that's one we probably have all used from time to time. So,
Oh, no kidding.
I don't know. Is there anything else we should talk about considering a plan before we head on to next?
No, I guess the moral of the story is make sure you understand how your plan works, especially on those things that you care about. So when I'm going through look at the summary benefits and just go through it. They're not as painful as they sound, and they're laid out by category. For example, office visit, specialist, emergency room, mental health benefits, prescription drugs. They're laid out so you can go right to the spots where you want to look at them. So take the time to look because it's important.
Yeah, I mean, just a quick note. I'm just such a numbers nerd that I took like everything that I had from like 2014, and then I equated it out to what I thought that the other plan was to see what I would pay. So it's quite it'll definitely open your eyes to see what you could anticipate spending. But that's just me. I'm a numbers nerd. So so let's talk about networks, because this is another thing that can be kind of confusing.
Okay. So the most common networks for under 65 health insurance, which means under age 65 health insurance, are HMO and PPO. HMO is Health Maintenance Organization, and PPO is Preferred Provider Organization. They're just two different types of networks. So a health maintenance organization, or an HMO, has negotiated contracts with certain providers, hospitals, doctors, specialists, etc., daytime surgical facilities, urgent care facilities, those types of things. They have negotiated contracts. So basically, if you're choosing an HMO plan, you want to make darn sure that any hospital that you would possibly want to go to, or doctor that you would possibly want to go to, or specialist is in that network, because the way the HMOs work is you either use the network. If they're in the network, the insurance pays. If they're not in the network, you pay. Plain and simple. So that's how the HMO networks work. The PPO networks work, they're a little broader. Oh, and I'm sorry, one more thing that's important about the HMO networks is typically you need, not typically, just about every time, you need a referral to see a specialist. So, I mean, if your doctor, if you think you should go to a specialist for whatever reason and you're a primary care doctor, the primary care doctor is king on the HMO plan. So if you feel like you need to go to a specialist and your doctor doesn't feel like you need to go to a specialist, then you have two choices. You can not go to the specialist, or you can find another doctor who will agree with you that you should go to the specialist. Everything is a referral with the HMO networks.
Right,
With
and all
the
the
PPO
while,
network,
you're racking up co-pays, right, to get those referrals, chances are.
well, you can be, and it's
Yeah.
not as dramatic as I'm making it sound. It can be for some people, as dramatic as I'm making it sound. I just want people to really understand this because, I mean, it's not like you can't go find another doctor, but you're right, that would get a little expensive. But 9 times out of 10, people don't just go, oh, I'm going to go see a specialist because I know I've got, you know, blocked arteries or whatever. You know what I mean? Usually you go to a specialist because your doctor's referred you anyway.
Right.
So, so that's what I mean by, but on the other hand, some people are like, there's something wrong with my knee. I know I need to go see a specialist. You know, things like that. So just as long as, and some people have great relationships with their doctors. Like, you know, if you have a good relationship with your doctor and you can talk with them and work with them, then they'll give you the referral.
Right.
So, you know, it's very, but you need to understand that the primary care doctor is king on an HMO.
Yep.
Or queen. On a PPO, you don't need a referral to go see a specialist. And the network is a bit broader. So you have in and out of network, I don't want to say, well, I guess benefits, but it's not that there's something that you could get in network that you can't get out of network. There are some things like that. But for the most part, say if you go with the PPO network, so it's the same thing, a negotiated contract with doctors and providers for, you know, we're going to be in your network, and if you use doctors and hospitals and providers in your PPO network, you're going to pay the best price. However, if you want to go see somebody who is not in the PPO network, you can still go see them. You'll have typically you'll have a higher copay or a higher deductible amount for out-of-network services, but you can go out-of-network. So a PPO would work well if, say, you want to go to Dana-Farber to see a specific doctor for a specific situation, and Dana-Farber might be in the PPO, but that specific doctor is not in the PPO network. You can still go to that doctor, and your plan will cover it. It'll cover it, though, at the higher copay amount, and you may need to pay and then get reimbursed, but you can still get care outside of the network. So it's not like HMO, where HMO, you use the network or you pay. You know,
Right.
PPO, you can, if you use the network, you get the better price. So then there's two kinds of HSA accounts. And the HSA plans, when you're choosing, and this is the reason I put these on here, I almost didn't, but then I thought people really need to know about HSA plans because they show up. You need to make sure that you look for them when you're picking a plan, because you could look at a plan and go, oh, that plan looks great. But if it's an HSA plan, basically what that means is you're going to pay everything out of pocket until you meet the deductible, and then the plan will start. There's typically no co-pays on anything on an HSA plan. So, so the benefits of it are you can, well, typically they're a little better priced, and the maximum amount of pockets can be a little bit lower, but you just want to make sure that, and they're also good, I mean, from a price point, if you're someone who just really wants catastrophic coverage, you know, you can still go, you know, you can get an HSA plan. The big advantage of having an HSA plan, though, is that it's a health, HSA stands for Health Savings Account. And in order for you to have, to be able to establish a health savings account, it has to be connected to a health plan that is compatible or is recognized by the IRS. So that's why they call them HSA plans. So what an HSA is, go to your local bank, open up a health savings account. You can get a debit card or a checkbook. And basically what you do is you put money into the account and take money out of the account tax-free, because you can take it off your taxes, as long as you use it for what the IRS has said you can use it for. You can't pay premiums with it, but you can pay for your co-pays, you can pay for out-of-pocket expenses for your medical visits, you can pay for, and it even covers things like dental and eyeglasses and such. So the idea being, it's like a little, it's almost like you're insuring yourself. So say you want to, you're going to have a health savings account, it's going to have a $5,000 deductible. The idea is that you want to be able to, over time, sooner or later, whatever you want to do, get money into your health savings account so that you've got $5,000 in there, so that when you do need to go for services, the money's in there, and you can just draw off your health savings account.
Right.
It's interest-bearing barely. I mean, just like any other cash use these days. However,
Right.
it's not use it or lose it by the end of the year. It rolls over. So say you put $2,500 in it this year, and you put $2,500 in it next year, and $2,500 the next year, and even if you don't use any of the money, it still accumulates as you put it in.
Right, and that's a pretty good thing. So.
It can, yeah, it is. Now, traditionally, the problem can be that the delta in pricing premium is not large enough to give you that extra money to be able to put in it, and that's a challenge people have with them. But people that are able to use them, it's a great plan for people that don't plan on going to the doctor, but they want something catastrophic, and give them a chance to self-insure a little bit.
Right.
So, and then, of course, most HSA plans have both types, so you want to make sure you know whether it's an HMO or a PPO network.
Right. Well, that's thanks for that. That can be very fuzzy. So, and I was lost on that until you explained it to me. So, thanks for that. So the next question that we have, and I know we're over, but this is really important stuff. So hang with us if you can. How would that's a typo. How would one get dental or vision insurance coverage?
Well, dental dental coverage is pretty much the same avenues as health insurance. You can purchase it on the exchange. If you go to healthcare.gov, you can purchase it right there. Some plans have it off exchange. You're going to buy it as a separate piece. Like if you buy it from an agent, you're going to buy it as a separate piece. Or if you buy it, say directly from the company. But dental insurance is pretty much the same as health insurance. Vision insurance is typically purchased directly through the insurance company for non-group plans. So you would go online. I would say just go online and Google vision insurance in your state, and there's a couple of good companies that'll come up, and you can purchase vision insurance. And then the other thing that I'd just like to point out on here is a lot of plans have, they say, with additional dental or additional vision, and you want to make sure that you understand the difference. Are you buying, if it's an added-on bells and whistles, typically it's a discount plan. So it's not the same as you go and it's a copay to go to the eye doctor, and they'll, you only pay $100 for glasses or whatever, that's insurance. The discount plan is, we'll give you a percentage off of our services, a percentage off of our hardware. So just make sure you know whether you're buying actual insurance or a discount program.
Yeah, I think I've heard about, and I haven't investigated these, and I think I'm probably going to start, but like dental.com, a friend of mine told me about that, which I think would be a discount program. It doesn't sound like it's a insurance program. It sounds like it's a discount program.
Yeah, I haven't looked at that one. I don't know.
But I will look into that. But while we're talking about additional coverage or different kinds of coverage, I did encounter something about supplementary health insurance. Can you speak a little bit about what that is, so that if other people get approached about that, could you just explain how that works?
Sure, like accident or cancer insurance or one of those types?
Yeah, I think Aflac is one of the ones that comes to mind.
Oh, okay. Yeah, they're different companies that do those, and yeah, typically they're called supplemental benefits. What I like to tell people is, and I'll talk about those plans in a second, but focus on getting health insurance first. Now, there are people that will pick up those types of plans in lieu of health insurance because they don't want to be able, or for whatever reason, they can't or don't want to get proper health insurance. I work with a lot of business owners and a lot of people with families and homes and that sort of thing. So my thing is always, even if you're just getting a catastrophic plan, get proper health insurance first. The catastrophic plans are great for if they're affordable, because they're all over the map. There's a lot of companies out there doing them. Most of them are good companies, but it's not proper health insurance. So accident insurance, for example, if you can get it for a really reasonable amount per month, the way it works is, say you have kids who play soccer, and you have health insurance, but you'd like that little added protection in case, because you have a high deductible, so you'd like to get, like if one of your children injures themselves playing soccer, you can use your accident benefit. So the way it works is it's mutually exclusive from your health insurance. So it's not like, well, your health insurance is going to pay so much, so we're not going to pay on that. It's completely a separate contract between you and the plan. Oh, excuse me one second, Sherry. Sorry, that cough snuck up on me.
Oh, it's okay.
And if you get hurt a little, they pay a little. If you get hurt a lot, they pay a lot. So, for example, if you break a bone, they'll pay $300. And I'm making these numbers up, but it gives you the general idea. If you break 2 bones, they're going to pay you more. If you end up in intensive care, they're going to pay you a lot more. If you end up, 5 days in the hospital after intensive care, they're going to pay you more. But it has to be an accident. If it's accident insurance. So that's how that works. It pays, so it can help you, and you can use the money for whatever you want. So, for example, I was in the hospital for 4 days. I had my emergency room benefit with my accident insurance. I had my intensive care benefit. I had my daily hospital amount. I'm going to get $5,000 to $10,000 for this horrible accident that I had, that I was in the hospital for several days. They send me a check. I can use that check for whatever I want. I can go out and buy a bicycle with it if I want.
Right.
Or I can pay my hospital bills or pay for food or whatever I want to do with that money. So that's what how those work. And then you can get it the same idea for they have cancer insurance. So if you get certain kinds of internal cancer, they'll pay you for each of the processes. That can tend to be a little bit more pricey. So the reason someone might want to buy those types of things, for example, I have kids that play sports that could get injured. It's a decent price, and I could use the extra money if there's an accident. But if that same child ends up in the hospital because of pneumonia, of course the accident policy is not going to pay.
Right.
Right. So that's how those work.
Yeah, I mean, I appreciate you explaining that, because that was new to me, because I thought if I had health insurance, why would I need anything else? So that was a surprise. So I just wanted to make sure.
Well, you may want to. I mean, if breast cancer runs in your family, and every aunt and your mother got it, and your sister's battling with it, you might want to consider getting a cancer policy.
Right.
Because those types of policies. Not the accident. There's no medical questions with accident, but if you have cancer, or if you've had cancer within like 10 years or 5 years or whatever their underwriting states, you can't get, you won't be able to get that kind of coverage. So with cancer insurance, or there's also cardiac type insurance or critical illness, they call it. So there's certain categories of disease that you can get that they'll cover. But you have to get the insurance before the event happens or you can't get it.
Right.
It's like life insurance like that.
Yeah, no, that makes sense. So does anybody have any questions out there? Is there any questions? I think all the questions that I had, I'm just trying to look because I had a couple extras, but I think we talked all about them. So if nobody has any other questions, we're over our time. I want to thank Alice for sure. That was great. I really appreciate it. This is being recorded and will be available on YouTube. So you can join us at these various email addresses internet addresses you can join the monthly webinars, or you can visit our blog. You can contact us for coaching at sherry@financialfreedom.com, or you can send questions to us and we will certainly answer. And please share this information with your family and friends. On August 6th, we're going to have money saving tips, and that will be done. I will be doing that webinar for us next month. So I hope everybody joins us, and thanks so much. And have a great holiday weekend. Take care, everybody.
Thanks, Sherry.
Thank you. Bye-bye.